So in our latest research paper, we looked at bilateral inguinal hernias in the ACHQC, and we did a propensity score matched analysis looking at bilateral inguinal hernias done open and laparoscopic or robotic. And we had about 3 times as many patients who were done robotically as open, which is not surprisingly, that's the trend, and guidelines have always said that if you have a bilateral hernia, you should have it done laparoscopically. However, with our paper, we demonstrated that in the ACHQC, patients who had bilateral inguinal hernia repair done open had on aggregate just as good as outcome as a laparoscopic in terms of recurrence, pain, complications. And we think that data is biased. We think that data is biased because about 40% of those patients had an open preperitoneal repair. And we know that open preperitoneal repair leads to faster recovery, better outcomes than malignancy repair. We've already demonstrated that in our previous research. And so our goal with this paper was to kind of dispel the myth that all bilateral inguinal hernias have to be done laparoscopically. It is just dogma. And we hope that more surgeons will adopt and want to learn the open preperitoneal technique because it's safer than laparoscopy. It requires less anesthesia in the laparoscopy and leads to the same or better outcomes. And so we want to challenge the next generations of surgeons to learn a better way.